according to this. So I'm going to call this meeting to order, and we're going to start with the Pledge of Allegiance, and the flag is by the door. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. First item of business tonight is the approval of the minutes of the regular board meeting March 8th. Anybody had a chance? Has everybody had a chance to take a look at it? Is there any corrections that need to be made?
I move to approve. Second.
Been properly moved and seconded that we approve the minutes of the last board meeting March 8th. All in favor signify by saying aye. Aye. All opposed?
Yep, it's going.
All right. Next item of business then is the approval of the general fund vouchers 78,488 through 78,551. Wire transfers 2021-0388 through 2021-0431.
Move to approve.
Second.
It's been properly moved and seconded to approve the general fund vouchers. As read, all in favor signify by saying aye.
Aye.
Opposed? Passes. Now the next item of business is the public comment section, but we're going to move that down to after new business item B. Review consideration of the board policy. 8450.
You want me hopping in?
Go ahead, Josh.
Okay.
Going up here.
Yeah, perfect. Thank you. I just want to say welcome to everyone. I appreciate you showing up, coming. I feel like regardless of where everybody stands on this, just the presence and being here is representation that you care about the district and care about your kids that are in the district. I truly do appreciate that. As indicated at the top of every a board agenda, and what Mr. French just said, that we're going to move the public comments section to after item B, which is the policy referring to the face coverings. The reason and rationale behind that is I hope will provide some clarity, and it might even answer some of your questions that then you may not want to present or participate in the public comments, and you might as well. But I feel like if we put it at that, then you'll have some clarity behind what our recommendation is. No action will take place, no directive. Once I give my recommendation and the board has dialogue, then we're going to open it up for public comments. You guys, then we'll ask that you keep it 3 to 5 minutes, just out of respect for everybody, and then we'll move back to item B and have that conversation regarding the masks. Does that sound good? Okay, so.
You want to go through the spotlight on education first?
We're going to table that for this evening. Yeah.
And then how about with the new business A?
Yep. We'll start with item A, just a response to COVID-19. So just a couple things I wanted to share. The vaccine rollout for the staff. The first round was March 19th. The second round will be April 16th. So. This week, Friday, will be the second round of vaccine for the staff. A couple things we've talked about loosening up in the district, and I'm excited that we are moving in this direction. The FFA banquet is in the near future. We've scheduled prom. That's going to be taking place. We've set the graduation date, and hopefully that will even loosen up as we get closer, as we approach that date. And then we started having conversations just about individuals coming in the building, and then field trips as well, and looking at what options we have for those. So I know we're at the tail end of the year, but we want to make sure that we can provide anything that we can provide throughout this school year. And then spring sports some have started. Junior high track has started, and WIA released those guidelines, so those will continue to follow the WIA guidelines. So I just wanted to briefly touch on some of those things that are happening in the district, and excited to see that we continue to move toward loosening things up and having somewhat of a normal school year, or end of the school year, I should say. So with that, are we good to move to item B?
Okay, item B, review consideration of board policy 8450.01, personal protective equipment during the pandemic and epidemic events.
Okay, so this is why everybody's here tonight, just the mask conversation, the mask topic. So as I stated at the beginning, just a little bit ago, public participation will take place immediately following this discussion surrounding face coverings and masks. We'll open it up for the public for comments to be made prior to any action, like I said, and prior to any direction from the board. As I share my recommendation and as you listen to the board's discussion, I ask that everyone just truly presume positive intent. And I feel like just us asking, you got everyone complying and putting the mask on, I really do appreciate that. I feel like that is a true representation of the district, even if there are individuals in this room to agree to disagree, but just to put on the masks, I feel like just as a sign of respect, I appreciate that you did it, and I truly mean that.
Josh, can I interject?
Yeah.
So you might notice a little bit of jittery in my voice, jittery a little bit in Josh's voice. You don't really plan for an event like this where you've got people that want to speak out. So what our purpose is here today is my purpose is to make the meeting run correctly. Josh's purpose is to look out for the kids, our kids, and our board's purpose is to look out for our kids too. And not just our kids, but all the kids and all the employees that are in our district. So I'm glad, thank the Lord, that we are where we're at today, because when this thing started up, it could have went the other way and looked pretty ugly, but thank the Lord that we're here and we're talking about pulling back the restrictions on things. So I just felt like I wanted to say
Appreciate
that,
it.
so go ahead, Josh.
Yeah. So this pandemic has created just an extremely polarizing environment, and the most polarizing environment that I've ever experienced, I think, in public education. And I truly believe that regardless of where all of us fall on this topic of masks, that we can agree that each one of us want what's best for our children and we want what's best for the district. I really wholeheartedly believe that. I think every single person in this room wants what's best for the Clear Lake School District. We have an outstanding and exceptional district, and we all want it to continue to be that way. I also hope that after listening to my recommendations and listening to the board, that you won't be able to determine where we fall emotionally or where we fall politically. That's not our job tonight. And that discussion regarding this decision is not to have our emotions or our political views impact the decision that we make moving forward with the Clear Lake School District. Our job this evening is to make a decision that's in the best interest of all students in this district, and it's not to make one based upon who's the loudest group, who's the most articulate, who brought the most representation at this meeting tonight, who didn't bring the most representation at tonight. It's truly to make a decision that's in the best interest of the district. So with that, as a district, our goals have always been the following: to keep students, staff, and community members safe and continue to keep the doors open so in-person learning can continue, which I believe we have done a remarkable job. And by the term we, I really mean we as teachers, support staff, administration, parents, and community members. Our students have benefited from our collective efforts. They really have. We've been able to stay in person 5 days a week with the exception of that 2-week period where we had a staffing shortage and we had to shut down. But other than that 2-week period, we've been able to maintain 5 days a week, and I'm thankful for that, not only as a superintendent, but as a parent of 4 in the district. And that really is everyone as a collective whole, regardless of where you stand on this topic. I feel like we've all done our part to continue keeping our kids in the building and keep school going. So over the past week, I've received emails, I've had numerous phone conversations, and I've addressed some social media posts, some of which have been negative, many attacking me personally and my leadership and our school board. But as I share my recommendation, I ask that you try to look at the situation from our perspective here. And by our perspective, I mean, how do we make a fair decision while ensuring the safety of all and ensuring that we do not compromise our district or open ourselves up for potential litigation? So here's where we're at. March 31st, the Wisconsin Supreme Court declared Governor Evers' emergency order issuing a statewide mask mandate unlawful. That's what happened on March 31st. So in other words, there's no longer a mask mandate in the state of Wisconsin. So then that means it gets kicked to the county. Becomes a county issue. In our case, Polk County Health Department has not issued an order, which means it then becomes a local level decision. And by local level decision, I mean it's now a school board level decision. We adopted or implemented board policy 8450.01, the personal protective equipment during a pandemic and epidemic event, which means that we would continue with masks. That was when we initially did that, the intent was so we didn't have to have a special board meeting. It wasn't to say that we're going to continue or not continue masks. It was just saying, let's have this policy in place. We'll continue doing what we're doing so we won't have to make a decision, an ill-informed decision, during the 11th hour. We wouldn't have to call a special board meeting. We'd just wait till the next board meeting, which is now where we're at, and then we'd make a decision. And I still believe that was the right decision. I think you'll see across, and I'm not here to judge other districts, but you'll be able to see that what other districts are making decisions quickly. And I feel like we've taken our time, we've talked through it, and I feel like we're in a good place in the district. So with that said, I believe we have three options in the Clear Lake School District. Option one, we remove masks immediately. Option two, we continue masks for the remainder of the 2020 school year. And option three, continue with masks until April 30th, which is that 2-week date after the staff vaccination for the second rollout, which is the recommended CDC guidelines. If we remove masks immediately, we run the risk of opening the district up for potential litigation. And by this, I mean it would potentially compromise the district by opening us up for the argument of forcing employees to work in an unsafe environment. I'm not here to debate whether or not it is an unsafe environment or isn't an unsafe environment. I'm just telling you what we're potentially opening the district up for. I also feel we need to be thoughtful and respectful to those individuals who have genuine concern for the transmission of the virus in an environment where we're in the environment of an absence of masks. On the other hand, option two has no exit strategy. There is no exit strategy regarding the mask, and it does not align with the CDC or the DHS guidelines. The guidelines for CDC and DHS for reopening, which I recognize that we're not reopening right now, but we're continuing to remain open. They don't use the verbiage or the term required. Which from the beginning we've said that we'd follow the CDC guidelines. Now, I say that with, I think we can all agree on either side that has been extremely challenging to follow the CDC guidelines. Releasing information and then with a 48-hour period, flipping the guidelines for 180 degrees. It has been challenging regardless of what you believe, who you believe. I think that's just a fact. I truly don't believe it's my opinion. They've contradicted themselves, which has made it challenging in our role. And really has caused a moving target for us in the district, and I think districts all across the country. So also, and I said that. Okay, so that brings us to my recommendation. My recommendation to the board is option three. Option three, this will move the district from requiring all students and staff to wear masks to an optional personal choice for all students and staff regarding the masks beginning on May 1st. And like I said earlier, the May 1st date is a reflection of April 16th is the second round of vaccine for staff members. The 2-week period is the guidelines that the CDC is asking businesses to follow, and that brings us to April 30th, which is, then the May 1st is following. So option three, I believe, also removes the argument for an unsafe work environment. And more importantly, I think it provides those staff members with reservations regarding the absence of masks or those experiencing angst with a safeguard. We've been told that staff members who receive the vaccine have a 98% efficacy rate. This is in regards to both contracting the virus as well as transmitting the virus. So my recommendation will be to continue wearing masks until the May 1st date. Beginning May 1st, the recommendation is to transition to an optional approach, like I said, and then the decision becomes on whether or not to wear a mask is a personal, individual choice for staff members, and then individual or family choice for those students that are coming into the building. All three options would require us to continue to follow WIA guidelines with all of our WIA affiliated sports, regardless of what option that is. If kids want to participate in the WIA affiliated sports, then we have to comply with the WIA affiliated guidelines. If a host school is requiring it, then my recommendation of requiring masks, even above and beyond the WIA requirements, then I feel out of respect for that district, we follow those guidelines, and in all honesty, they would have the right to say you can't come here and participate. But one impact that I want to be clear on is the impact of contact tracing. And let me back up before I talk about the contact tracing, because I feel like you may think that my option 3 really I believe runs the risk at upsetting both sides. I do. You could make the argument that it's a middle ground, but I think in this politically charged and emotionally charged environment, I really feel like it would. It has potential to upset both sides, but I still believe it's the right decision. And we run that risk of upsetting both. I really feel like if we make a decision that we feel like is in the best interest of the district, I personally feel like option 3 is it. So the impact that it would have on contact tracing, there's really one impact that it would have on contact tracing. The 6-foot criteria, that doesn't change. If you're within 6 feet, that doesn't change. The thing that changes is if you're not wearing a mask and you're within that 6-foot proximity, there's no longer that 15 cumulative minute time frame that we have to calculate on our end to see if that person should be excluded from the district and meets the criteria for exclusion. If a mask is off and you come into contact who eventually tests positive within the time frame of the criteria, then it's an automatic removal for staff or students that have not been vaccinated. And that continues to be the guidance that we have to follow. That's not the district level guidance that we created. It's the guidance that we're following from the county. So that really could have a large impact on who we're excluding from the district. But with that, since the end of February, so about the last 2 months, we are seeing an extremely low rate of transmission among students and staff. I said this from the beginning. I still believe it. It's hard to look at county numbers. It's hard to look at state numbers. It's hard to look at any other numbers than our own numbers. I feel like there's too many variables at play, and it's hard to know what you're actually looking at, and it's hard to know how they're determining numbers. But one thing that we do have control over is our own numbers. We know those for a fact. And what we've seen in the last 2 months, we've had 2 students that have tested positive for COVID-19, and we've had one staff member in the last 2 months test positive for COVID-19. We've excluded 4 staff members over the last two months, and then we've approximately excluded close to 20 students in the last 2 months. Whatever we're doing, and I'm not here to say that the masks do work or they don't work. All I'm saying is whatever we're doing, whether it's luck or it's something that we're doing, it's been going really well. And I think that we've been able to keep our children in the doors and in school, in seats in front of teachers. We had a little bit of a scare during Thanksgiving and Christmas. I wasn't sure if we'd even be able to come back, after break. But since then, knock on wood, things have been going extremely well. So I just wanted to share, kind of our personal numbers. So I want to say this in closing. This continues to be a politically and emotionally charged topic, and as a district, I really want to make sure that we just respect where everybody's at in this. I know we're all in different places. Option 3, I feel like will like I said, be most likely the unpopular option, but I still feel like it's the best option for our district. And it would be much easier for us to look at where the majority of our families and staff members fall on this and make a decision based on that. However, I wouldn't believe in that decision. And in my role, I feel like and I think there's maybe even some in this room that would disagree with this, but I feel like I'm and the board and our admin team have made really good decisions throughout this whole process. It's not been easy to navigate, and there's very few people in the middle. This is one of the most polarizing topics I've ever experienced, and most people are on one end of the spectrum or on the other end of the spectrum. There are very few, I feel like, in the middle. So with that, I just want to say that our decision, we really shouldn't make a decision based on emotions or political beliefs, like I said. And as I stated earlier, our goals remain to be, and have always been, even pre-pandemic, to keep everybody safe, and to continue to keep our doors open and in-person, so in-person learning can continue. So with our goals in mind, my recommendation to the board is option number 3. If we want to keep the doors open, I believe it is in our best interest to continue requiring masks until May 1st. But I want to say this, regardless of what the decision is, tonight I challenge each and every one of us to be kind, to be respectful, and to remember that what we say, our kids hear, what we do, and what we choose to do with our actions, our kids see. And the bottom line, each and every one of us, I truly believe this. There's not, otherwise you wouldn't be here. I mean, really, each and every single one of us in this room, we want the same thing. And I think we need to keep that in mind. And by the same thing, I mean we want an exceptional district, which I believe we have. The Clear Lake School District is an awesome district, and we want it to continue being an outstanding and exceptional district. So with that, that's all I have to say. So now before we open it up to public comments, I'll roll this back out. I want to open it up to the board. If you guys have any questions for either myself or our admin team, or if you want to discuss kind of the recommendation or options.
So you want us, this is our discussion time before we start with public comments?
Yep, and then we'll open it up for public comments, and you guys can have another round of discussion if need be, and then make a final not necessarily decision, because there won't be action made, but direction given to the admin team.
Okay. Does anybody have any questions or any?
What kind of feedback have you gotten from the teachers and staff, I guess, Josh, if you want a question?
Presented this, similar kind of proposal with the teaching and support staff, and I thought it was well received. I do think that we have individuals that are have genuine concern with removal of the masks prior to and after the vaccination. I think that's we have both sides, I think, of the aisle within our teaching staff, and I don't think Clear Lake is unique to what we're seeing across the country. I think our country is split down the middle with some of this stuff, and so as far as the feedback, some asking about, just kind of questioning, what if, how do we operate within our own classroom, and those type of questions.
Was the 6-foot immediate exclusion, is that from DHS or CDC? Who did you say that was from?
No, it's both. CDC had put some verbiage in the 3-foot. What's that?
Polk County is the one making us do that.
Well, it's from CDC, and then the CDC kicks it to DHS, and then the county. So the county and DHS follow the guidelines of the CDC. The only difference is the exclusionary factors for if you're a close contact coming back. There's some discrepancy between the DHS and the CDC. But right now the CDC released a 3-foot proximity, which I don't fully understand that. I personally, I think that was kind of a political, it doesn't impact any of the exclusionary criteria that we're dealing with. The 6-foot continues to remain, continues to be the proximity that we have to use for the exclusionary process. Does that make sense?
Yep. And would the procedure stay the same for students being to come back, still a negative test?
Yep.
10 days exclusion, so all that stays the same?
Yep, 7 days with, so if they're close contact, 7 days with a negative test, they can return on the 8th day. If they choose to not take a test, if they remain asymptomatic, they can return after 10 days, which is the 11th day. And then if they test positive, then they're out for 10 days.
So Josh, what would it look like? Sounds to me like right now the masks are buying us 15 minutes of contact time before somebody gets excluded, or whatever term you use to tell the child they can't come to school for however many days. once the masks are gone, and let's say Johnny rides the bus, gets, he's in a certain class somewhere, what would that look like for you when you got to do the contact tracing? Would that whole class have to?
Nope, the even indoors or outdoors, the same requirement is the 6 foot criteria. So if a whole room has a mask or absence of masks, you still use the 6 foot proximity. So you don't, if someone tests positive in the classroom, you don't automatically just say everybody's going home now. We've had to do that with like the little buggers, like a kindergarten, just because they're all over the room. But if you use like a junior senior high where there's not as much movement, it would be whoever's within that 6 foot proximity for any amount of time, then they're identified as a close contact.
Even in the hallways.
And would be sent home. Correct.
There's no 15-minute period.
Correct.
So then how would you, you just ask everybody if they have they been close to Ryan Munson or not, and you just rely on their integrity to answer the question truthfully?
No, well, in some scenarios, but in most cases we've been using the cameras. We look at the cameras to see, like the lunchroom is a good example of that, where there's, they're eating, so their masks are off, so we have to look at the cameras, see who was at the table, if that student got up and moved from point A to point B, and then we'd identify them through that way. Hallways would definitely get a little bit more tricky just because there's a lot more movement, through the hallways.
But without a mask though, right?
Yeah,
My
correct.
question was if we didn't have the masks, how would that be for you to contact trace? If the masks were gone and somebody came in the building, does that, you were answering that question, right?
Yep.
Okay.
Yeah, I think the biggest factor would be the hallway traffic. That'd probably be the most challenging to try to identify who was in close contact. Everything else would be pretty much the same with what we're doing. We've we interview kids, talk to the kids in the classroom, and do our. It really is just our best effort to try to identify. And I'll be the first to admit we've got some wrong, I'm sure, but we do our best to try to identify who was in 6 feet proximity for that cumulative 15 minutes time frame. So yeah, like if kids didn't have masks on, the hallway traffic would definitely be challenging, to say the least. I think most of the other areas would be pretty similar to what we're doing now, as far as it might even make it easier, because then it would take out the factor of trying to determine if they were next to them for 15 minutes. It would just be an automatic, yep, they're definitely within that 6 foot proximity. If they're not wearing a mask, and then they'd be removed. So if someone does test positive who's not wearing a mask, and you have an individual that is wearing a mask, then we would use the 15-minute criteria for those individuals.
Once if we were to roll that out on May 1st and it's an option, how many people in the district do you think would still wear masks?
I don't know. We've talked about that just on either side. If the majority do wear masks or don't wear masks, then our biggest problem or challenge becomes, we don't want to ostracize one group. And I've even at the faculty meeting, which we'll cross that bridge once you guys give us a directive. But then do we just have masks? Whether or not you've been vaccinated or not. Like if you've been vaccinated, you believe that you can't contract or transmit the disease, do you still throw a mask around your neck in support of others? I think that's been or will be one of our biggest challenges as we move forward. But whatever the decision is, we've got households that are on both sides of this. We've got kids on both sides of it. We have staff members on both sides of it. And I think the bottom line for us is, how do we move forward as a district, as one district, and really support one another regardless of where we stand. So it will be that's going to be part of the process when whatever the decision maybe ends up being. I don't know if I answered your question on that one, but I don't know if there is an answer.
Any other questions?
Yeah. Has every staff member had an opportunity to get vaccinated if they wanted to? Is there anybody that's not been able to get an appointment?
And part of my feeling where I don't believe it would be an unsafe work environment is we rolled it out and made it an opportunity for all staff members to get vaccinated. We're at about, I think we're at like 61% of our population that got vaccinated. So we did it in-house. Chet's, who was amazing. They were fantastic to work with out of Amory. They came in, did it, provided the opportunity for anybody that wanted to. And like I said, the second round is on April 16th. So.
Okay, any other questions before we move in? I hope that everybody sees that this isn't, for us at the board level and discussions that we're having, that they're not political, and they're not, you know, we're just trying to meander the stream here with our kids. So we're going to start the public comment section. And
so with the public comment section, because we're recording it, so I'll move this out for you to whoever's on the list, and we'll have an opportunity at the end. If there is someone that wasn't on the list, we'll give an opportunity for those individuals to be part of it too. But we ask that you, just out of respect for everybody's time, we try to keep to 3 to 5 minutes. We ask that you come up to the podium, state your name, state your address, number of kids in the district, and then speak your piece and try to, like I said, try to keep it to between 3 to 5 minutes. I want to thank you in advance for your participation, and I also want you to know the board reserves the right to, not respond to the public comments. We want to make sure that we get through all of it. So the intention behind the public comments isn't to create dialogue between the board and what you've got to say, but definitely want to hear what everyone has to say. So when you come up, just please state your name, please state your address, and then please provide the board with what school your kids are currently in. So, and I hope that wasn't misinterpreted by my comment of this isn't a time to create dialogue. That's just how the open meeting rules, how an open meeting functions. So it's not a disrespectful thing, but we just want to make sure that we get through and give everyone the chance to be heard. So, unless you had anything else to say.
And if they're speaking, they can take off their mask.
What's that?
They can take off their mask.
Yeah. If you want to come up, just ask it when you come up. Feel free to take your mask off and address the board. Okay. What do we have first? Mr.
First is Michael Larson. Come on down.
Michael Larson. I live in the village of Clear Lake. Do you really want my exact address? I mean, it's fine for me. But
maybe you just, as long as we hear what municipality you're in, I'm good with that.
I live in the village of Clear Lake.
Thanks.
I have 4 children that graduated from this district, and a lot of former students and colleagues and friends are here. As you probably know, I've worked here for 30 years. I stand to support the Clear Lake School Board in their decision to continue with this mask mandate for the moment. I applaud your decision to follow the advice of experts and science rather than listening to conspiracy theories or a particular political agenda. As many of you know, about 1.5 years ago, I was diagnosed with non-Hodgkin's lymphoma. Since then, I underwent major surgery, 2 months of recovery, and then began 5 months of chemotherapy, just as the first waves of COVID-19 began to hit the United States. I was immunocompromised during the chemotherapy and then for 6 months afterwards. Throughout this time, my family and I worried greatly that I might become infected. There were those who said, if you're scared, just stay home. And for the most part, I did. But I had hospital and doctor appointments, pharmacists and clinic visits I had to attend. My family had to buy groceries, get gas, and so on, and my wife had to work. We were lucky. We are now vaccinated. My Aunt Dorothy was not. She contracted COVID last November and died. In a small community such as Clear Lake, the school is a hub of connectivity. Even those who seem to have little or no connection to it are affected by what goes on here. Furthermore, many with conditions that make them susceptible to the disease are directly affected, whether they are students, parents, staff, volunteer, or just members of the community. I don't understand the mentality of those who would put the lives of friends and neighbors at risk. I just don't understand that. My wife is a special education teacher at Chautauqua. She works with the youngest and most severe special needs students. For 8 months, all of her students, including those with autism, Down syndrome, and other severe impairments, have complied with the mask mandate. If they can do it, so can we. So many of us have given up so much to get us this far in this country. We can wait until it's safe before we remove our masks. Thank you.
All right, next up, Stacia. How do you pronounce your last name, Stacia?
Hefferly.
Hefferly, okay.
Yep. Live in Deer Park. I have 2 kids in high school and junior high. So I looked up online effects of wearing masks in children and the emotional side effects. I got it off of nationalfile.com and stridentconservative.com. The physiological effects can be shortness of breath. I'm sure I know with gym class they're not, running and jumping up and down and that, whatnot, which I've really appreciated. There's decline in pH levels, there's toxicity, inflammation, self-contamination. I'm thinking of the little ones that are sneezing in their masks and wearing them, or touching germs and touching their faces and whatnot. Increased stress hormone level, increased muscle tension, immune suppression. I've seen chronic stress condition. My kids no longer like coming to school. They dread it every Monday because they're so tired of wearing these masks for 8 hours, 9 hours a day, wearing them on the bus coming here. And it's the rules, and they get it, and they wear it. But, it's not up to me to make them like it. Fear. With these little ones, they've never had a normal school year. They started off wearing masks in pre-K. They don't know what a normal school year looks like. They don't know what it's like to make friends and not be scared of them. So, or to look at someone and say they don't have a mask, they're going to make me sick. It kind of breaks my heart a little bit. Insomnia, fatigue, the list goes on and on. I would just love to see, May 1st, if it could be optional. So if you want to wear a mask, great, do it. If they work, you should be fine. It's kind of what we've been saying for the past year. But if you don't, have it be a personal choice. That's all I'm asking for. So I love your recommendation. I think it would be wonderful for our district and our families. Thank you.
Thanks.
Jamie Brandt.
My name is Jamie Brandt. I live here in Clear Lake. 2 kids in the elementary school. And to bounce right off what she was saying about my children as well, we're in love with school, and this year they completely dread every day. I do exaggerate a little because I shouldn't say completely, but it is every morning. Do I have to wear the mask? Every day. And my biggest problem since the beginning of the school year, I guess, is more so there hasn't been any mask training for these kids. I send my kids with 3 to 4 extra masks a day. They come home in the same mask. They are 6 and 8 years old, and I have been training them at home every single day. I say, wear your new mask, wear your new mask. I don't see anyone actually actively caring about their health or safety based on that, because they're in their tote bags, they're in their pockets, they're ready to be changed. But yet they are scolded for not wearing it or touching it or pulling it down. Why aren't they? There is not one day that they have been told to change that mask on by anyone in the school. And we're supposed to be changing our masks throughout the day. So you guys brought up a lot of litigation problems with the school board and with the employees, I don't hear any concern for litigation in regards to mask training for any of these kids in any of the schools. As you can tell, I'm pretty passionate about this because even for people with immune deficiencies and compromised immune systems, wearing a mask will make it worse for them as well if they are not being followed properly. I appreciate your guys', and I do love this school, all right? I do, but this has come to the point where I don't understand how there hasn't been any mask training. No pamphlets at home, nothing for us to go over with our kids. Hey, we're concerned about our kids' health or safety. You should be too. We have stuff for fire safety, tornado safety, if a shooter comes in, all these other things, which we have a higher percentage of dying from than we do from corona, especially if you're a child. But you are raising their chances of sickness and unhealthiness by making them wear this mask without any training. Excuse me. And furthermore, now I have to ask, are you guys in favor of vaccinations without parents' consent or knowledge? Because there are schools across the country that are implementing this, at least the idea, and maybe it hasn't come to fruition, but it is a huge concern of mine.
We can't have any dialogue with you.
You don't have to, I understand. I was just giving you a chance to because you said you didn't want this to become a non-dialogue event. Also, so this concern for other people's health and safety before coronavirus was never implemented for such a low death rate for anyone. I guess to compare the coronavirus's death rate outside of Clear Lake is much higher than in Clear Lake, the rate of death. So based on our numbers in Clear Lake, as you mentioned, we would like to focus here, not on the rest of the country and what they're doing and their numbers. Our numbers here in Clear Lake are exponentially better than the rest of the country, rest of the state, and rest of the county. So I believe our city is doing a very good job. And I don't know if it has anything to do with the mask, because you go into the gas station, the grocery store, I mean, it's 50-50. See the masks or not. So at that rate, I don't know how 50% roughly or so is actually helping. Those are the only two places we really have to go, all day long, 6 a.m. to 6 p.m. Bars in this town are also going with the regulations lifted. There are no masks. People congregate at the bars. We have a lot of people getting together, not wearing the masks, and we do have a very good death rate here and contraction rate as well. So something to think about as far as your decision. And then we are waiting to remove these restrictions and wanting to see, give it a good test run, right? But when everything happened, everything was instantly put into place. I get the fear and I do understand it, but please take that same approach. Next time, if things lift, take that same approach in the beginning as far as rushing to implement these orders when we didn't know. States that haven't required masks and states that have, I'd say it's really hard to tell which area the masks played a role, because Texas is open and there are a lot of positive things to say about the states that haven't had a mask mandate. And then as far as other schools and requirements to follow when we do go visit for sporting events, out of respect to them, what other requirements beyond that would we want to follow? I mean, to what point does this get ridiculous? I guess is my concern on that level. I do understand the respect, and I do respect your guys' decisions, whatever does happen here, but that's about it, so thank you.
Thank you.
Jen Safner?
Hi, I'm Jen Sefner, and I live in Deer Park. I have 3 children in the school district of Clear Lake here. I'd first like just to say and echo a thank you to all of our school board members as well as our teachers. Working this past year, it has been an extremely challenging year. Me, myself, as a healthcare worker, navigating the CDC guidelines, the contradictions that we've had this time has been extremely challenging. And you have been able to maintain that the school is open most of the school year and have had a positive learning environment for our kids, which is very much appreciated. So now 13 months into the pandemic, as a healthcare worker, and I can talk about the statistics in the county I work and live, which is St. Croix County. We have vaccinated about 80% of the population 65 and up, and this is thought to be the highest risk population, as that is the population of people that we saw the highest rate of death in. The other 20% has been thought that they simply are choosing not to get vaccinating, as there has been ample opportunity since January and supplies of the vaccine have been adequate for the rest of that population to be vaccinated. Our educators have had the opportunity, at least for the first round of vaccinations, and as Mr. Ernst stated, the CDC and the science guidelines are that we would wait 2 weeks after being fully vaccinated with the 2 doses is recommendation that the highest efficacy rate is there, which depending on the vaccine is between 95 and 98%, and that is higher than even a normal flu vaccine is. We have opened up the vaccination option for 40 plus years of age to individuals. So we have been slowly moving age groups at a nice rate. I don't know where Polk County is in that process, but Polk County has been having higher allotments of vaccines than what St. Croix County has been getting. So I would venture to say it's higher. So if we're talking science and level of protection for those who feel that vaccine is their protection, we're looking fairly safe. So I'd also like to speak like hospital rate. Part of the reason that we asked people to mask up as healthcare workers was it was overriding our hospitals. The number of people we were seeing in our ICUs and the hospital volumes were at an extremely high rate that we've never seen before. We know now there's about 2.5% of our population in our region that is contracting COVID, which has dropped significantly. And most of that population is in the younger people, which we are not seeing the death and we are not seeing the hospitalizations in either. So I am grateful for your recommendation, Mr. Ernst, that we open up the opportunity for it to be optional for masks starting May 1st. As I do feel if we were looking at science, the science is there for the efficacy of the vaccine, and that just in general, our kids can feel like they're getting back to somewhat of a normal life. As a healthcare worker, we have seen a big rise in suicides, mental health illness, and substance abuse, and so I think lives are being taken in other manners and not just COVID, and I do think that does impact our youth with what they're seeing at home and what they're experiencing. And so I do ask, and I would fully support Mr. Ernst's recommendation being approved by our school board.
Okay.
Okay, last one on our list here is Dana. And if anybody wants to go after Dana, feel free, just raise your hand and I'll invite you to come up.
Hi, I'm Dana. I live right outside of Clear Lake here. I've got a handful of kids that come to school. They're in the elementary. I see both sides of every story when it comes to this. My mother-in-law had severe cancer. She wears a mask. She also works in the medical field. I agree 100% with you that it should be via choice. Nobody else should be able to make an adult decision for another parent's child. People are very strongly opposed to the mask. Some people are very strongly for it. I respect both sides. I really, really do. But there's got to be some kind of level ground here. My kids are very active in sports. One thing I noticed this year, my daughter played basketball, and everybody is touching the basketball, playing the game, but at the end of the game, not a single one of them are allowed to shake a hand. That doesn't make any sense to me personally. And I know that goes with other sports, wrestling and all that kind of stuff. Even with them wearing masks, that's not stopping the whole germ thing. Schools are a breeding cesspool of germs. Like, my kids come home with something every year, whether it's strep or whatever. It helps build their immune system. But, I also see the side of kids, coming home from school that wear a mask all the time that are getting extremely, extremely sick. My daughter has a really rare brain disorder, and I've told you guys in, the first meeting that we had this, she was afraid to even cough or go to the nurse because she had a headache, That's sad. I know kids are still feeling that every day. I think that it should ultimately be left up to the parent. I understand teachers feel that they're at risk. Kudos to them. I give them props for hanging in there, dealing with the students, because I'm sure you have a lot of students that really fight this. But at the same time, they come into the school year every year as well, knowing the risk that they may pick something up from, kids at school or whatnot. The coronavirus has been around for a very, very long time. We actually vaccinate our cattle for it. I believe it came up in the 60s is when. So these cases are still continuing every year. There's coronavirus cases. You just don't hear of them. I'm not saying that it is not a serious condition. It is very much serious. But I think politics have really blown this out of control. And it has really helped divide not only the country itself, but bringing it down to such a minute level of just small communities. I don't wear a mask anywhere I go. I don't, neither do my children. The only time I actually wear a mask is so my husband can get care at the VA. That's it. My husband had gotten COVID this year. None of the rest of us had it. We all were just fine. I know that was a huge concern for us, is getting it, but we did not. And he recovered just fine. But like I said, I 100% agree with you. I think that it should be right down the middle. If you want to wear it, go for it. At the same time, it gives the kids that opportunity to make that decision on their own as well. Through this entire pandemic, kids really haven't had to say it's you're wearing a mask whether you like it or not. They don't get to ask, well, how are you feeling today? Is that uncomfortable? And my kids are in that disgusting puberty stage. It's gross. They're starting to get, the zits and everything, and with, the masks on them all day, they don't change them, nothing, it's a whole mess. But I do think maybe one thing that has benefited not only our school district, but other school districts, and maybe across the country as well, is people have really stepped up in their hygiene, washing their hands more frequently, using the hand sanitizers. So is it just the masks that are helping? Personally, I believe not. I believe everybody's kind of stepped up to that extra level of, oh crap, we really need to go back to washing our hands and stuff. So, like I said, I have nothing against those that wear masks. I really don't. I understand the fear. But in all reality, there's nothing to fear but fear itself. And you can't live in fear the rest of your lives, or you're not going to live. And to bring children into this as like a pawn, that's not really fair. I say we let not only the parents have that choice, but give the kids the opportunity to make that decision, whether or not they want to wear the mask. It's a big turning point. It's a big social interaction type thing. And no matter how old they are, they should have at least some kind of a say. So that's all I ask, is that you guys all take that into consideration as well. It's not just us adults making the decisions. Kids have to do it too. So, thank you.
Thank you.
Okay, does anybody want to step up too?
I do.
And then we'll get to you over there.
I'm Stacy Wagner. I reside in the city limits of, or village limits of Clear Lake. I have 2 kids in the high school. I just want to say that I'm relieved to hear that we're talking about recommending getting rid of the strict Band-Aid on masks. I think the only middle road at this time, because for every anti-mask scientific study, there's one on the other side that says the opposite. I think the only middle of the road is to have personal choice and personal responsibility in this, and allowing people to decide that this is what's best for my family, this is what's best for, and that's it. I don't need to tell anybody else how to live their life. And I think that applies to schools as well. The parents and students should have that discussion in their own home and be allowed to do that as they see fit. And I hope that you consider getting rid of the mask mandate or policy immediately. I appreciate that you're considering it soon, but I see no reason to continue it today. Thank you.
Good evening, I'm Scooter Madison and I live at 423 30th Street in Clear Lake. I have a son in 6th grade and then I have a daughter in 8th grade. I am a former employee of the school, so I just want to reiterate that I back up the staff, I back up the school board, but I also feel that at the beginning of this thing, we had said that, or the school board had said that you were going to follow the state mandate, and now that it is not a mandate, I feel that we should be moving forward as to having the option of wearing it or not wearing a mask. I am for an immediate change in that, but I also get having the 2-week grace period after the vaccine. I just hope that you really consider how well the whole community and our students have really put forth the effort to follow the mandate that has been in position, because it hasn't been easy. It hasn't been easy as a family. For us, we don't wear masks. The only time that we are wearing masks is at our school functions, and we will continue to follow that because we want to watch our kids in sports. But I really, truly hope that each and every one of you will at least consider to have the mandate of the school be done by May 1st. And I thank you for your time.
Thank you.
Okay, anybody else? What here, and then we'll go back there, guys.
Okay. My name is Dennis Scoggins. I live right next door here. I have a young daughter attending this high school. I applaud you for sticking with the mandate that you have. Even though the state says, or the Constitution says, that it's unconstitutional in this state to do that. I appreciate what you're doing. If we're going to err, I would rather us err on the side of caution. I'm a 64-year-old immune individual, okay, who's had heart surgery, diabetes, and I live at our other residence so that my daughter can attend here. And I really, really think these masks help. I can't stress that enough. So I applaud you for making that decision. I would say we keep the mask mandate until, how many more weeks until the end of the year?
Till June 6th. Or 4th, I'm sorry.
Right. And we've been doing this for 9 months here. I can't see us dropping this mask mandate any sooner than that. Thank you.
Thank you.
My name is Amber Super. I have 2 children that attend the elementary. I live within the district. As Greg mentioned, I can only imagine how you all feel. You guys are put in the hot seat. It's been a really politically charged thing, and everybody has their own stance. That's why we're all individuals. That's what makes us great. That's what makes everybody great, is that we can put all of us as individuals together in a district that is cohesively wonderful for our students to attend. I would say that each individual decision comes to a general consensus. That's why we're here tonight. I would implore the board to, and I know you will, look at both sides very carefully and think of how you must feel sitting in that seat tonight, knowing that the decision you're going to make is going to upset someone no matter what you do. Think of how those kids feel every day. And I mean, I understand that they're children, and that essentially adults make decisions for children to make them the people that they are. I get that. That's our job as parents, to make our children wonderful, to make them be people that we're proud of and that other people are proud of. They represent our district. But I would ask you to think of how they feel as well. Put yourself in their shoes. You get butterflies in being here and knowing what people are going to say and how it's going to be interpreted. Think of how those children feel every day. Some children have mental and cognitive delays. Some children are immune compromised. Everybody has their own quirks and tics that makes them who they are. I would ask that you, as a district, leave it up, I guess, to the parents in their decision as to whether they feel it is best for their child or not best for their child. Like I say, we personally have a very charged household. There's a lot of things that we have to consider with our kids as we doctor a lot and those types of things. For reasons that are, not necessarily relevant at this time to mention, but it's things that we certainly have taken into, consideration in those types of things, as it's a pretty big deal in our house. But I guess I would just ask the board to please, kind of consider that as parents, we make good decisions. We make the good decision to send our kids here. We make the good decision to have you as our administration team and trust your decisions to make the best choices. Think of that when you're essentially making this decision. We trust you to make good choices. We trust you to make good choices for our kids. Think of those little people and the choices and how they're feeling about all of it. So, you say, not political one way or the other, as it's become this rather large smear campaign. Just think of how you feel personally. Think of how your kids are. A lot of you sitting here in these seats have kids in this district. Think of how they feel when they come home or what they say. No kid likes to have basically a cage on their face. Nobody does. Heck, adults don't like it. But, I would ask that you just, kind of take into consideration the feelings and the thoughts of how you mold your kids and the choices that they make. Adults are essentially the governing body, but we have to think of our little people too and how they feel. Or some of them that are becoming big people. Of course, I'm a mom of little people, but some of those are adults too. We're going to be cutting those kids loose. The graduating seniors this year. We've molded them for years as a district and a community and everything else. Let's help them to make good choices. Let's set an example that, they're becoming people that are going to essentially, kind of join together in the community as adults. Let's give them a little bit of say. Let's trust the parents. We trust the kids to come here and for everybody to make good decisions. Let's give a little bit of faith to those people. That's all I've got. Thank you.
Thanks. Nikki?
Nikki Sunday. I live out on County Road Q. We have 4 kids in the district. A couple of years, we're going to throw another one in. I'm just going to kind of reiterate what it seems like the majority of the people have already said here today. From the last meeting we attended, you kind of know where I stand on it.
I supported the board when they said there's a mandate in place, you know, we kind of, public school, you follow public recommendations, and we got that, we supported you. It's not the case anymore, you know what I mean? The mandate was deemed unlawful for you to tell us that you have to wear a mask. I don't understand why the school would do any different. You know, like she just said, we make our decisions for us and our kids every single day. That's what parents are there for. That's what parents should be there for. We shouldn't have to just cheaply follow what a handful of people say. I get that there is fear out there. We can't be so afraid of losing our lives that we lose our livelihood. I think that that's what's happening. I think that, you know, I have 2 in the high school and 2 in the elementary. My high school kids have they're old enough to form their opinions. They can educate themselves. They form their own opinions regardless of what I say. They're at the point now to where I've taught them to be independent, to do that, to research and formulate opinions. My 2 younger kids, like I have a kindergartner who doesn't know any differently anymore. Like, she leaves the house and that's just what you do. You know, and it's such a cutoff for her with other people. The connection isn't there, the personal, you know, like, there's so many things you tell by somebody's face, how they're feeling, what they don't say. You know, I can't remember the percentage, but how much of your body language is so much more than what actually comes out of your mouth. And the kids aren't getting that anymore. They're getting that you stay away from people, you don't go outside this group, you only talk to this certain person or this certain 5 kids that you're allowed to see. And I just think it's unhealthy. I think it's so unhealthy to teach our kids to live that way. I feel like we've gone on for how many months with enforcing the masks. There are so many kids that are together outside of school hours and school activities that don't wear masks, that it's almost funny to watch them then come into school and have to put a mask on to talk to people, because they're all together outside of school without them. So I don't know how much I believe masks help. I think that it's more of people's peace of mind. It's in your head. It's what you think it's doing. But I don't know how much there's actually scientific support to it. And I just think that we're a public school. Let's follow what we deemed lawful. And at the time we were following a mandate and we supported you, even though mandate's technically not a law, it's what they said we should do. And we all said, okay, we get it. But like I said before, it's just not the case anymore. I think it's time to do away with it. I can respect your idea of waiting, you know, the 2 weeks with the vaccinations. I respect it. I don't support it. I think it's just time to do away with it. I'd be more in support of doing away with it immediately.
Thank you.
Thank you. Anybody else want to come up to the podium?
I'm Lisa. We live on 25th Avenue. I have a son in 5th grade and a daughter in 3rd grade. And everyone, I'm pretty sure in this room, knows where I stand on this issue. I've been very vocal about it.
I know.
I appreciate your recommendation, and I would totally be fine with that. But I want to say that we've all been affected by COVID. Currently, my in-laws are fighting it. My brother-in-law, who has massive heart issues, is fighting it. And you know what he told my husband yesterday? We shut down for this? That's ridiculous. The 2 weeks we first shut down, yeah, I get that. We needed to be prepared. But this last year has been a joke. It's been ridiculous. Our kids are suffering. My kids, for 9 months now, have come home every day complaining of headaches. I've spent hundreds of dollars on masks trying to find something that works for them so they are comfortable at school. We tried the homeschooling, and my son's like, no, I need the interaction, Mom. So I sent him back. He loves school, that he wants to be there. But this year, both, every morning, do we have to go? Why do we have to wear this mask? Can we just stay home today? And I've let them, on certain days, I've let them. They need a break. And you know what, I really wish at some point we would have implemented, because some of these school districts went Monday and Tuesday and then Thursday and Friday. Maybe we should have had Wednesdays off. Give these kids a break from these masks, because they needed it. My son, we came back from a basketball game, and we had to do an inhaler all night long. He has asthma. I couldn't get an exemption. This stinks, and I see both sides. I do, I really do, but I don't believe the masks work. I don't believe they help. I don't wear a mask anywhere I go except for in the school district and other school districts that I sub in. That's the only place I wear a mask. My son, we're a family. We go out. My kids have the choice to decide. Sometimes my son will wear a mask because he wants to. Sometimes he doesn't. But it should be their choice, along with our choice as parents, to allow to decide what they do. It should have never been taken from us. And our Supreme Court has agreed that that decision should have never been taken from us. And I really hope, as a board, that you guys realize that this is a parent's decision, a family's decision, not your decision to make for our kids. I appreciate every single one of you guys. And I know you guys are in the hot seat. And I know we all may not agree on certain things. And I may have said some things that I shouldn't have. But our kids come first. And I will always speak up for my kids. I will always be their voice. And right now, as you can see, all these parents are their kids' voices. And we believe that the mask mandate has ended and it should end in the school district. When? I guess that's up for discussion, because who knows? My sister-in-law, currently fighting COVID, had both vaccines over a month ago. The vaccine is not a cure. Vaccine is not going to prevent you from getting COVID. There's been proof of that. The news the other day reported 43 cases of people that had the vaccine over a month ago that were tested positive. So that shows nothing. That vaccine, to me, is nothing. So I really hope at least you take either the recommendation to immediately get rid of the mask or Mr. Ernst's recommendation for May 1st. I mean, I can live with both because at least my kids have a chance to finish the school year somewhat normal. Thank you for your time.
Thank you.
I am Sasha Rondo. I live in 30th Street in Clear Lake. I have 3 kids in the school district, 1 in the high school, 2 in the elementary. I guess all I'd like to say is it's very important to me as a parent that I teach my kids to follow the rules. It's very important that I teach them the morals that when there is a rule in place that it's important and it's for a reason that they follow it. I also feel that it's very important for my kids to be able to decide for themselves what's best for them and to learn that path. Through this, it's been very difficult for them to walk the line between being able to make decisions that are best for them and trying to be respectful of the rules. I personally do not feel that I don't wear a mask outside of here. I feel like it should be their choice to make their decision which way they want to go with that. I also don't want my children to feel like in order to do what they feel like is best for themselves that they have to break the rules. I don't want that morally to be something that they have to debate between their health or their morals with following rules. So I would support, of course, that being their decision as early as possible, but I do respect the decision that, there's others involved, and I respect everyone's decision on their own to decide if they should wear a mask for themselves. And so I would support your recommendation for May 1st.
Thank you.
Okay, does anybody else want to?
So I don't know anyone who likes wearing masks, right?
Right.
Anyone here like it? No. I think we're all on the same page, we're all on the same side when it comes to nobody wants to wear a mask, right? Unfortunately, we're in a pandemic. Whatever you think about the pandemic, wherever you think it came from, whatever, it's here and it's affecting us. It's affecting our kids. You guys are about to make a decision for our kids, but you're making a decision for all of us and for the whole community and beyond. So, it's too soon to stop wearing masks. Like we were talking about earlier, if we stop now, when someone is infected, their whole class is going to have to quarantine. We don't want them to miss things like prom, graduation, sporting events. They're going to have to be out for a couple weeks, whatever it is, right? If we just, we're all sick of this pandemic fatigue, it's real, If we just hold out a little bit longer, it's like a couple more months. Wait till the end of the year. Keep the masks. Next fall is going to look a whole lot different. We've got the vaccine rolling out. We've got all these people getting it whenever. We're looking at May 1st for the teachers, not for the kids, right?
No, the recommendation was for all staff and students.
You're looking at vaccinating the teachers and waiting 2 weeks till they're fully vaccinated. What about the kids? So they're still going to spread it to those who haven't gotten the vaccine yet. They're still going to get it themselves. There's long haul effects, et cetera, et cetera. Whatever you think about anything, I don't care. I probably think it too. I'm really middle of the road on that stuff. My point is, what's the harm in keeping it so that we know we can have graduation, so that we know we can have track and field and whatever events, I just think it's rash to do this fast. So Wisconsin voted it down. Good for them. So you can go to a liquor store without a mask. Like somebody said, good for them, right? You guys are in control of this right here. Each person that came up to this podium has a reason for wanting or not wanting the mask mandate. This has changed my kid's personality, or this has, and I feel for them. I understand that. My parents had to be shut in for a whole year, and it affected them big time. I'm a caregiver for my dad, and I couldn't go and help. I helped, but from afar, So I have all these reasons, I'm biased, I have all these things that I could tell you of why I want the mask mandate to stay. But the bottom line is, let's do this for the kids, Let's ensure that they continue to stay in school, have graduation, ceremony, whatever. All the things they had to miss last year, which sucked really bad, Nobody wants to wear a mask. But what if it's just for a little bit longer? Next fall is going to look different, you guys. Thank you.
Thank you.
Anybody else? Okay. Well, that being said, then, thank you guys for all coming up. And I know it's not easy to come up and speak at the podium either. And you guys stand up for your kids. When you stand up for your beliefs, that's big. That's big stuff.
You're here for our kids as well.
And our kids.
There's a lot of people that have things to say, but they won't come here and say it in this public forum. So then I guess we'll move on to open our discussion back up at the board level then.
Okay, well, thanks for coming to work today, guys. We appreciate you.
So one of the questions that I've got, Josh, is what happens if this resurfaces in our district? What kind of a plan do we want to, how do we want to handle that?
If we see an increase in numbers and we start to exclude either staff members or students, at a high rate, I mean, I really think that we'd have to have a special board meeting to make a decision. Do we implement this policy back into place, and talk through what our options are. Because right now with this recommendation, I mean, the only thing changing would be the one variable of the mask. So, and I do agree. I do feel like there are multiple variables that are at play, and I'll be the first to admit, I've said this in other meetings, I don't know which of those variables are having the largest impact, if any of them are having an impact. I think there's a lot of different things. The masks are one. The amount of sanitation and cleaning that our staff, our teaching staff, our support staff, our custodial staff, administration, we're all kind of doing our part to make sure things are cleaned. And to be honest, I have 4 kids of my own in the district, so a lot of what you have all said resonates with me, and every one of us up here have kids in the district, and I think that's what makes the board administration, in my opinion, a very strong team, is because these aren't our students, they're our kids. They're our students and our kids. So we're doing a lot of stuff that really should have been done in districts across the country from the very beginning. I mean, little buggers they stick their hands and fingers in their noses in places where they just do, and we've done a lot more hand washing and before and after recess and lunch, and so there is some of that. We also put into place some things in the district which I think some were good decisions and some ended up not being, just because of the recommendations we received, with plexiglass and then the change, and I don't know how effective that truly is having. So I guess with that, if we do see an increase, either it'll be either coincidental or it'll be tied, to the one variable that we are removing, which I see as masks. So then, I guess to answer your question, that we'd have to just revisit the policy that we currently have. I mean, we're not getting rid of that policy. It's still a board policy, so we would have to have that discussion. Do we want to re-implement that and have masks across the district again?
I was just wondering if we had given any thought to what would happen if we got to that.
Yeah. I think everyone up here and everyone here tonight and everyone that will eventually listen to this, I think no one knows what the right decision is. I truly believe that. I think we're going to make the best decision that we can make with the information that we have, but there are a lot of variables in play that we don't know.
So one of the things that came to mind, somebody will get up and speak and I get swayed to what their line of thinking is, and then I go to the next person. And I'm sure you guys have been on both sides swashing back and forth in this pandemic boat that we're riding in, but now I lost my train of thought. Sorry.
That's right. Any other questions?
Well, I can't think of what I was going to say, so anyway, that being said, so we'd have to have a special board meeting then to switch back or take some action. This is what I was going to say. One of the things, depending on what we decide here today, it's going to be every household, the decision's going to resonate in every household. That being said, if we do elect to get rid of the mask, would it be a good thing to maybe send out some type of information, letting kids know and let families know, okay guys, we might, or if the decision is to lose the mask, we're going to lose the mask, but we still want to have graduation and track and field and this and that, and maybe remind everybody to be cognizant of the fact that there's still possibly a pandemic that's going around, and let's try to keep our house free of that so we can do the things that we want to do. The respect that you guys had for us when we asked you to put the masks on, when you go to somebody's house, their rules apply. It's their house, right? And when you guys came into, this is our house, this is all of our house, and sometimes, you know, you guys are respectful by putting the masks on. That's how it is. And anyway, and another thing, and I'm just throwing stuff out, I guess, don't give me the microphone, but we just came off of Easter too, so, you know, my kids were with kids from Green Bay and La Crosse and everywhere else this last weekend, and I just wanted to throw out there that there might be something that happens from that if somebody came in contact with somebody, so depending on what we decide. I guess I'm going to voice that maybe May 1st would be the date, because anything that happened from that time maybe could bubble up and we could be done with it by the time May 1st came about. I guess I don't know.
Yeah, and I would strongly encourage you to take the option 1 off the table. I really don't think I think that opens the district up for potential litigation, regardless of what you feel or believe. I think that's a fact. I mean, it opens us up for litigation for, not to say that, you know, someone would sue the district and win, but it would certainly open that argument up, and I feel like we would have to have, you know, our attorneys in that discussion, and it would cost the district. I mean, to say that I think there's a valid argument, whether you believe it or not, isn't what I'm saying, but I think there's a valid argument for someone to say that we'd be forcing employees to work in an unsafe environment. I think that would be a real thing that we'd be dealing with. So I strongly discourage option 1, but obviously it's your guys' decision as far as removing the masks immediately. And I don't think it's the right thing to do when we have individuals in the district that are working that truly believe what they believe and have fear and angst over this. I don't think it's the way that we should treat employees if they're feeling that way. I think, you know, I don't like the masks. I have 4 kids of my own. You know, it's like I've said before, it's not fun to wear it, but I think if it makes someone, you know, employees comfortable for a little while longer, you know, I know in my household we're willing to do it, but so I think option 1 would be could be problematic for the district if we remove them effective immediately.
Well, then let's just kind of flush it out then.
What we decide here for our school district has no effect on WIA or Lakeland. WIA Sports and Lakeland can still decide masks are required, and we have no say in that.
Yeah, so what we've seen, you know, at the beginning of this, I said I'd be meeting monthly with the county schools. That quickly, I've been meeting with the county health department. I've been meeting with the county schools. Our intention was to try to have all of the county schools aligned with what we're planning to do. And from almost, you know, immediately, it was very difficult. I mean, everybody was dealing with their own, you know, local stuff. So that really hasn't been, I mean, for the most part, we try to, you know, what we've been doing is more notifying each other of what we're doing rather than aligning. The Lakeland Conference is not making a motion or has not made a decision, will not make a decision on the masks requirement, to either require them or not require them. WIA that's we have to follow. Either you follow it or you don't compete, and you don't participate. That's a non-negotiable that WIA is put into place. So that's not whatever our board decides, doesn't matter as far as the WIA affiliated sports is concerned. So we'll have to, if you want to participate, if you want to compete in a WIA affiliate, you have to comply with their guidelines. So right now they issued the spring guidelines. They have loosened up a little bit. And what we've been doing with WIA is to the best of our ability. We've been following, just because there's some things that it's almost, you know, impossible to comply with some of the recommendations or guidance that they've given. So we've really been doing our best. So like one of the recommendations is have a baseball bat for every softball and baseball player. Well, bats are ridiculously expensive, and so what we're doing is making sure that we're wiping them down in between, or doing our best to wipe them down in between. They've also, like baseball, kids are not allowed to have sunflower seeds in their mouth in the dugout, kind of. So, but anyway, those guidelines we read and then we follow within the WIA guidelines. So, and kind of to answer your question too, as far as if we see a increase in cases, I do. If I had my best guess would be it'd be kind of similar to the Thanksgiving Christmas where we were just hanging on by a thread. It became a staffing issue. Thankfully, we haven't had it. We haven't internally with our staff. We haven't had any severe cases or cases that haven't resembled anything more than flu-like symptoms. We haven't had any recent scare, with the exception of one individual. So I would see if we did have to make a decision, it would become a staffing issue rather than, because we saw that the exclusion criteria created a staffing issue almost immediately for us. And so if we do see an increase in number, I think we're going to see a staffing issue before anything else. And then we'd have to call a special meeting and decide. Does that make sense?
Yeah.
Okay.
Yeah.
So if we waited until the staff was vaccinated 2 weeks, we could potentially avoid a staffing issue.
Yeah, so waiting to May 1st does two things. One, it creates, I feel like, a safeguard, and it removes the argument of an unsafe environment. And then two, due to the exclusionary criteria, if you've been vaccinated 2 weeks after your second round of vaccination, you are no longer, or I should say you are exempt from the exclusion criteria. So 60, I think it's 62% of our staff have been vaccinated. They no longer, if they're a close contact, they don't have to go home or be excluded from the district. So that will help us tremendously as far as the close contact is concerned.
And keeping our staffing numbers.
Say it again?
And keeping our staffing numbers so we can stay open.
Correct. Because one thing that really benefited us during that hard stretch, we had surrounding schools, that the larger surrounding schools were not in person. So then our subpopulation, because we had subs that weren't comfortable coming into sub until they were vaccinated, but then because New Richmond and Amory and some of the surrounding districts were not in person, our sub pool was very large, so we were pulling from all other areas, and that really helped us out during that time frame. Because and then we were able to remain in person.
Does anybody have anything else they'd like to say before we flesh out what we want to do? So we're looking for a motion then?
Not necessarily a motion, but just a directive. Almost if kind of you guys go around, and so I know exactly what the board, or if you want to say it from the board perspective, but a motion doesn't need to take place. It doesn't have to be an action item.
Okay.
We just want to know what we're communicating out to families.
Okay, so let's just go around the room then. Christy, what are your thoughts?
I think we left effective May 1st.
Right?
I'm with that.
Nettie?
May 1st.
Yep, I agree.
There you go, Joshua.
Okay. Sounds good. I think one thing that we will do too internally, and we'll have to navigate this carefully because there'll be families that are very much opposed to the masks, which everybody's entitled to their opinion, but just talk through like when more of a teachable moment with the kids, like when is it appropriate, when is it, if we are passing through the hallways, if you're wearing a mask, it's a good time to wear a mask. When we first started this, the athletes were one. Some of them wanted to go virtual and not be in that. So I really do think some of our athletes are going to want to continue with the masks just so they don't run the risk of being excluded, especially the higher competitive ones that that don't want to compromise potentially a run at the postseason. So we will be doing that and talking with the staff.
Well, and that being said, talking about the kids that if there are kids and families that still want to wear the masks, should I send my kids to school with masks and just have the kids put them on to respect and be kind to the other kids that are wearing a mask, or how do we not ostracize the kids that are still wearing masks?
Yeah. I personally think, the mandate itself to just have a mask on all time was not common sense, personally. It didn't make any sense to me to have a mask when you're walking outside, some of the things that they identified as far as outside. So me personally, I think one of these are great, as you're walking. When I'm sitting right here, I'm 6 feet apart from everyone, and I think it would be appropriate for me to take my mask off and start working. So I don't necessarily want to say kids should or shouldn't wear masks. It's everybody's individual, I think, your personal opinion. I think it's, especially with our older kids, I think it's going to be more of a teachable moment of let's make sure we have one of these, and when you're moving and transitioning from point A to point B in the school, throw your mask on. And in the classroom, I mean, and I speak generically because each classroom is very, very different. I think there's a lot more movement in some of the younger level classrooms. So I don't know if I can answer. I don't want to answer your question. I think it is a personal choice, but I also think some of the requirements to wear masks at all times isn't necessarily appropriate. And I think everybody's in a different place too with whether or not they feel the mask is effective or not. I think our kids and our staff have done a phenomenal job. But in all reality, I think we've been very accommodating and loose with, you walk through and there'll be a kindergartner, with the mask on to the side, and just because they're little and they do struggle with it at times, and some of our older kids really do a nice job wearing the masks effectively. So I don't mean to skirt your question, but I think it depends on the age level of the kid. It depends on where you're at personally in your household. Depends on whether or not you believe the masks are effective or not. But I really appreciate the board direction on continuing until May 1st, because I feel like it allows us to roll it out to the vaccine to all the staff, and then to it, I feel like it's a sign of respect for those individuals that have major concern or angst with this virus.
Okay. All right. All right, well then, that being said, then the next item of business is C, the approval of the junior senior high school HVAC installation. And you guys are welcome to continue and be at the board with us, but if you want to leave too, you can do that too. I know how it is having kids.
And before everybody leaves, I would like to say how much I appreciate the respect that everyone has shown tonight. I know, like I said, this is a very polarizing topic, and I appreciate everybody's willingness to wear a mask. But even just as importantly, just the approach that everybody had with communicating what they wanted to communicate, I truly appreciate that. So thank you. Yeah. And have a great evening if you choose to leave.
Okay. Item of business is the HVAC installation.
Okay, so I threw that in there. We are in need of replacing the HVAC system in this building, replacing the controllers in what you'll see. This is the junior senior high school cost, and then the kind of weight room gym area is the second price. I'm meeting with XL Energy. It sounds like they'll be doing a 50% because of the pandemic and the connections that the pandemic has to the HVAC system. There's a lot of incentives right now, so kind of aligned perfectly with what we've needed to do in this building anyway. So we're meeting with XL Energy to see how much of a kickback we'll be able to get with installation. So my plan is to use the Fund 46 money to hopefully purchase to start that project. So you'll see the $137,000 for the replacement in this building, and the $57,000 for the weight room, and I think that's tied to the food service area as well. It's kind of that area down there. So it's a big ticket item, but we've been, we were talking about, do we try to tie this into a future referendum or not? I mean, it's something that has to be done eventually. So thought this would be a perfect time. We do have some the CARES Act, the round 2 money will be coming in. We might be able to use that, or we might be able to use the Fund 46. So depending on kind of how much the cost it's totally going to be. So I don't have an exact number for you. I just have the quote, but I don't have the XL Energy number that's going to be as far as a kickback. Like I said, I meet with them on Wednesday, I believe.
Do we have enough in the Fund 47 to cover this?
We do, yeah.
Okay.
Yep, we have plenty to cover this. So whether it comes out of that or the round 2 of the CARES Act, we should have the amount of the round 2 other ESSER CARES fund at the end of this month, is what I've been told, that we should know that dollar amount. My guess is that's going to be about $100,000 dollar range, which wouldn't cover this total cost, but if we used it, for this, then we could. Otherwise, we'll just take it out of the Fund 46.
Isn't there something in elementary you're going to do a year and a half ago or something, or is that part of it?
Well, remember, so this was the original thing that I showed you. We were looking at maybe replacing some of that stuff over there, but because it was tied to the referendum, the contract that we had with like Nexus and some of the other, that was the big one. We decided to hold off. So this is just specific to this building, and none of this was done. Everything in here was when it was in '97, I think it was '97 when the building was built.
Yep.
Yeah.
So,
I was here.
just air conditioning you're talking, Josh? Is this just?
This controls everything. So it's the controllers to all of that.
Because there's a real discrepancy in the coldness in the junior high wing and the
Yes.
high school, and I mean, kids are getting cold.
Yeah, and we've done kind of makeshift where we've jammed like cardboard up there to try to the intake. It's very cold down in the junior senior high, and then you'll have some of these classrooms are extremely hot. So it's hard to control the temperature and keep it consistent across the district. I believe the band kind of area gets really cold too. So
this will take care of
yeah.
So this will take care of all the fluctuating.
Yep, this will take care of that.
Yeah, now that you bring up the controllers, now I remember we were talking about this
Yeah.
a couple of years
So is it just wore out or what? Or they did a poor job when they was
No, that's a different stats to taking out the pneumatics.
See, the building is full of tubing.
23
It's
years
rubber
old.
tubing, it's disintegrating, it's cracking, and it's leaking air, and it's air pressure that controls the dampers in the ductwork.
Gotcha.
And there's so many leaks they can't find them all anymore.
Yeah.
This changes it over to electronic controls, so we don't have to deal with air leaks anymore.
And so like at the elementary, Tom has a computer that he can do it from the computer and adjust the temperatures pretty easily. So that will be that. So go ahead.
Your conversations with Excel focus on energy, I suppose, is
Yep.
one of, yep, okay.
So looking for approval to move forward with this installation. This would take place they said they could do it right when summer hits. It wouldn't impact summer school, and they'd start working in this building.
I move to approve the junior senior high school HVAC installation.
Second.
It's been properly moved and seconded twice to approve the junior high school HVAC installation. All in favor, signify by saying aye.
Aye.
All opposed. Motion passes. Next item of business is the approval of 21-22 CISA 11 shared services contract.
Okay, so the CISA contract is in there. Nothing different from last year, other than the amount of days that we've been purchasing a day or two here or there for consulting on different things. That the consulting that I have listed, the 2 days would be tied to the standards work. So you'll be able to see all the boxes that are extra, just renewals that we currently use as used from CISA.
Okay, I'll entertain a motion.
I move to approve the 21-22 CISA 11 shared service contract.
It's been properly moved and seconded to approve the contract. All in favor, signify by saying aye.
Aye.
All opposed? Motion passes. Next item of business is the approval of Welding Academy and Start College Now applications.
Okay, so this one's a little unique. Usually you guys either approve a Start College Now. So this is the first time that we've ever bringing anything to you it's called the Welding Academy. Yeah. It's through the New Richmond High School, and it's a dual enrollment program that our kids would enroll into that's through the WITC program. So I put a Plan A in there and then a Plan B. Plan A is what the kids are proposing, or what the district, I guess, is proposing, and I would recommend. If the board says, if you guys don't want to do that, then it shifts to Plan B, which is the traditional kind of Start College Now. So I put the information in there for you to look at too. It's a welding program that these kids would have access to, and then a welding technical diploma. We briefly talked, we didn't have any kids apply, but Clayton had something similar where they did like a construction dual. What's that?
Construction essentials.
Yeah, it was a dual credit program through the tech, and it was construction based program. So this is really ultimately the same thing, except it's with New Richmond High School, and it's tied to welding. So the kids have their applications in there, and the letters in there as well. So my recommendation is that that you guys approve Plan A for these two students. We feel like they'd be a good fit for that program and really get something out of it. And I think it would be beneficial.
Transportation and liability work with that.
So transportation, they would be on their own, and it'd be similar to the kids that transport themselves to WITC that we've done in the past with those kids. So same type of deal. And then they would function if WITC has a snow day, then they follow those guidelines or not guidelines, but I don't know. I guess guidelines.
So Josh, I'm sorry, I might have been daydreaming, but why Plan A over Plan B?
I just put why? Because it's specific to it's almost like a welding school, and they get a certificate out of it. It's on site there. I think it would be Plan B is multiple credits. It's also through the WITC, but they'd be enrolling in specific classes.
You'd get the same results if you took the same classes, because basically they're just offering WITC classes in the right cluster to get the technical diploma.
Yeah.
They could do the same exact thing through Start College Now. They just have to pick those same classes.
Correct. Yeah.
The instructor is different and the location's different.
If only we had someone from WITC here to explain.
That's pretty cool.
Yeah.
Well, the WITC is helping with New Richmond's thing then? Or no, this is just New Richmond's?
You have to have an instructor that meets our credentials for the post-secondary, and then you can offer, so it's both math and welding. So you have to have the two instructors.
Okay. I was just curious, I guess.
And then it would be accredited through WITC.
You need a motion for both of those?
I'm looking for one.
I move to approve the Welding Academy and the Start College Now.
Second.
So we're moving to, we don't need the second part, do we?
No.
Just the welding.
Just the Welding Academy.
All right, so then motion's been made to approve the Welding Academy and seconded. All in favor, signify by saying aye.
Aye.
All opposed? Motion passes. Next item of business is the spring coaching roster.
Okay, put the spring coaching roster in there. There was one revision. I crossed out that name. So everything else is in there for you. As far as track, middle school track, baseball, softball, and then golf.
I move to approve the spring coaching roster.
Second.
It's been properly moved and seconded to approve the spring coaching roster. All in favor, signify by saying aye.
Aye.
All opposed? Motion passes. Next item of business is approval of a van purchase.
Yep, so this one is a 2009, the big white van. I think it's 11 or 12 passenger van. It's the big one. It's in kind of starting to get in rough shape. So we looked at what our options were for trade-in value. So right now I gave you the Lincoln Ford, or what's that?
Go ahead.
The I'm sorry, Link quote, and then the Johnson Motors out of New Richmond. So I give you two quotes to look at. This one, and similar to the next one. So a lot of these purchases, we're getting close to closing out the budget. So what I'm looking for this one is approval based on whether or not we have the money at the end of the year. So as we get toward the end of this year, we'll start closing out the budget, and we'll be able to know. We'll be able to figure out how much money we have at the end of the year, and if there's enough money to make the purchase and trade in the white van, then I'm just looking for the authority to do so. So we don't have to wait till the end of the year, see how much money we have, and then come to the board. So
So for the Johnson Motors, is it 37 for purchase, or is it 37 minus the 4,000 for trade? Looking at 33.
Let's see. So
37, because it lists 46.
say it again.
It lists 46 under the total.
I think it's
46 minus 4.
Minus 4, still not
Still
right.
No, I think it's. I think.
37 minus the 4.
Yeah, I think it is too. It's 37,443, and then with a trade-in value of 4,000. So we're looking at, roughly 33,000.
There's a $500 difference between these two bids.
130.
What did I just say, 500?
Yeah.
Yeah, $100 difference.
Yeah, the link is, the purchase price is 38,000, and then the trade-in value was 5,200.
Would this be something like we do with a school bus where we really need it, we could split it between this year's budget and next year's budget? We used to do that where we kind of...
Yeah, we tried doing that last year, but the auditors aren't in favor of that anymore. Yeah.
Well, we sure ended up with a nice bus.
Yeah.
Well, I said, if it's $100 difference, do we want to do our warranty work in Rice Lake, or do we want to do our warranty work in Richmond?
Richmond, I'm guessing.
Yeah.
All right, so should we make a motion to buy one from Johnson Motors in Richmond, if we have the money to?
I move to approve a van purchase from Johnson Motors if we have the money to do so.
Been properly moved and seconded to approve a van purchase. All in favor, signify by saying aye.
Aye.
All opposed. Motion passes. The next one is a gator purchase.
Okay, and this one might have to be tabled. I was hoping to have more than one quote for you, but Tom wasn't able to get more than one quote. So we're looking at purchasing a gator if there's money in the budget for at the end of the year, and the gator would be used for multi-purpose. We'd also use it for snow removal in the winter. The gator that we last purchased has been we use it all the time. The coaches are using it. We use it for hauling stuff. We use it on Earth Day. We've used it even during the parade. Tom had came to me and said, would there be an option to look at possibly purchasing a second gator with a couple more bells and whistles, so that way we could use it for the snow removal in some of the sidewalk areas and some of that stuff at both of the buildings. So it's up to you guys if you want to approve a purchase of the gator prior to, or we could table it until you guys have enough quotes to kind of look through and look at. I'm fine either way.
Yeah.
That's great.
All right, next item of business then is the approval of our resignations.
Okay.
So when we have resignations, I don't know. Sometimes we've read the resignation letter and sometimes we haven't, and I don't know why. But I think we're just going to from now on read them. Is that okay with you guys?
Are you going to read them?
I'll read them.
Okay.
Unless you want to read
Yes,
them.
I'm okay.
You want to read them, Christy?
So the resignations, there's 3 listed in your notes. The last one is not a resignation at this point. That one's still up in the air. So right now we have 2 resignations. One, Dave Hendershot, part-time custodian, resigned after less than 1 year of service. And then Lori Olson, elementary kindergarten teacher, has made the decision to retire. And she has taught in the district for 35 years. So huge thank you to her for her service. She's a fantastic teacher and will be a big loss to the district. And wish her the best of luck in retirement. So you have one letter, and it's from Mrs. Olson.
And it's addressed to Mr. Ernst, Mr. Peterson in the school district of Clear Lake. I'm ready to notify you my intent of retiring at the end of the 2021 school year. This is in accordance with the terms of the 2021 School District of Clear Lake Employee Teacher Handbook, section early retirement. Although early retirement for 35 years of service,
that's just the verbiage that's in the handbook.
Anyway, I would like to take this opportunity to express my gratitude to the District of Clear Lake for the support that I have received through my 35 years of employment. I will sincerely miss this position, my colleagues, and this wonderful school community. Respectfully submitted, Lori Olson. So I will entertain a motion.
Move to approve?
Second.
Been properly moved and seconded to approve the resignation of Mrs. Olson. All in favor signify by saying aye.
Aye.
All opposed? Motion passes. The next item of business is our approval of hires.
So we have 2. One is the first one is a current employee. We just had, in the absence of Michelle Wire's absence, that she's shifted into that role. The second one is the new junior, senior high school principal position, which we could table that and discuss in closed session if you guys would like.
So then we will move on to our review and approval of our canvassing committee.
But do you want to approve Tammy's first?
Do you wanna do hers
Yeah,
now?
you could do hers.
All right.
I move to approve the new hire.
Yep, just the Tammy Lowerson one.
Yeah.
Yep.
Okay, properly moved and seconded to approve our new hire of Tammy Lowerson. All in favor signify by saying aye.
Aye.
All opposed? Motion passes. Then the next item of business is the review and approval of our canvassing committee.
Okay. So we met on Friday. Mr. Grosskreutz joined us for the canvassing committee. So the numbers that I submitted to you guys, the unofficial numbers, ended up verifying. So those are now the official numbers. So we have Kirsty Kobernick with 413 votes, Nettie Grote with 378 votes, and then we had a scattering of 43 votes. This is my 6th year. I'm still not sure what the difference between scattering and write-ins are. I believe scatterings are write-ins that are not registered, but every year I get a different answer. So, and I've looked it up, but I know it's a type of write-in, but I'm pretty sure it's individuals that have not registered for a write-in, and then write-ins are individuals that register after the time frame, is what I believe. So we had 43 scattering votes. So totaling 834 votes. And then I have the election documents for you guys to sign when we're done. Any questions?
Need a motion for that?
Nope.
But the next thing is our official oath of the new school board members.
Ready to read, Chrissy?
I'm like, what page are we on? Is it the I undersigned?
165.
Who have been duly,
Yeah, there we go.
yep, ready?
Ready.
I, the undersigned, who has been duly elected to the Board of Education of the School District of Clear Lake, but not yet entered the duties thereof, swear, affirm that I will support the Constitution of the United States and the Constitution of Wisconsin, and faithfully discharge the duties of said office to the best of my ability, so help me God.
Do you have a pen, Dave? So maybe one for you and Mr. Christie.
Have a good night, guys. Thanks for coming.
So Josh, there's only one here. Do we,
I can pull mine.
I got one.
Is it? Should be on there, isn't it?
Here,
Here,
I got it.
that's okay. Nettie's got one.
I think this was the salt and I
You're all like this.
This one?
And then I apologize, but the reorganization shouldn't have been on there. Reorganization of the board we'll have to do next May, according to our board policy.
May?
Yeah. No, I'm sorry, next month.
You mean in May?
Yes.
Okay.
Board of Canvassing, we need you to sign this, Skip, probably.
There.
Yeah, they're different. Okay. Here, Josh, there's your mess back.
Thank you.
Alright, okay, so then the next item of business is N, I believe, discussion of appointing a board member to hand out graduation diplomas.
Yes. So the graduation is set for Friday, May 21st at 6 o'clock. So wondering who would be interested in attending to be part of the ceremony.
Can we nominate somebody? Like nominate Christy to do it?
You can do whatever you want.
You did a good job last year.
I'm not opposed to it, but I don't want to be the one to always.
I second.
Nobody has any kids or relatives or anything on this year?
Are you serious? Nobody wants to do it. It's all right, Christy. All right, speech. Give me your microphone. Let me shake it. Oh, can't shake hands. Okay.
Don't we usually do a welcome by the board member?
Oh, yeah.
A welcome
Yeah.
speech. That's
They've
the
been
same
stellar
person.
the last 2 years. I'm just telling you, right?
Oh, so this is for both handing
This
out
is, yeah.
candy.
Yeah.
We're adding in the school song this year too.
Unless we have a
Sung by
senior
the
that wants to
sitting
do it.
principal.
For one last hurrah, come on.
All right, well, then Christie got nailed this year. All right, the next item of business is the approval of board policy 0143.2, board member information requests.
So this is up to you guys, and I threw these on there just because we'll have to do them next time if we don't do them tonight. But I wasn't sure what tonight would look like and how. So if you guys want to table these until next time, or if we want to go through them tonight, I'm good either way.
Can we go through half?
Yep.
Or 2 out of 5?
Yeah, we could do that.
Does anybody want to take a bathroom break?
Are we allowed to do that in a
I'm
public
just throwing it out there.
Do you need a official approval?
I'm just asking.
I'm good.
Everybody's okay?
Thank you.
All right. So if we can't take a bathroom break, let's table it.
Okay. I'm good with that.
I'm okay with that.
How about we all take these pages home and read through them, so we don't have to sit and read through them
Sure.
for 15 minutes? So pull them out of your books, read them, so when we come back in May, it's quick. Or we read them before, too.
Yeah, feel free to pull them though if you want. And I.
All right, and then the next item of business then would be our superintendent, known as Mr. Ernst.
Yep, and we've talked enough. I don't have anything new to add or to go through that we have.
All right, then let's move on into our contemplated closed session. Thank you, everybody, for coming and supporting us.
Thank you, guys. Have a good night.
Hey, are we going to do the Ag and Tech Ed presentation next month?
Yeah.
Next meeting. We figured not everybody was gonna wanna come with us.
Why not?
We did suggest it because we thought if the parents were willing to sit through that and then talk, then maybe.
That's what I thought that was for. We were using some tactics.
And it was originally sold as like, here's your bright spot in your meeting, but you'll have to wait. It'll be better.
All right, so
Have a good night.
WS 619.85, paragraph 1C, considering employment compensation or performance data of any public employee over which governmental body has jurisdiction or exercises responsibility. We will be approving approval of consideration of employment. So I will pull the board. Nettie?
Yes.
Skip?
Yep.
Myself, yes. Ryan?
Yes.
Christie?
Yeah.
All right, we are in closed session. All right, we return to open session. I will entertain a motion.
I move to approve the hire of the high school principal.
Second.
It's been properly moved and seconded to approve the hire of our new principal, who is.
Mr. Brian Melberg.
All in favor signify by saying aye.
Aye.
All opposed? Motion passes. I will entertain another motion.
Future agenda items?
Oh, thank you.
Board policies we didn't do.
That's so we have spotlight.
Future agenda items.
And then
isn't
spotlight on
me.
it.
But
It's on the
anything that-
Second page.
Oh, boy.
There's a 2-pager this time.
Yeah. So what do we have? So we'll put.
We have the spotlight on Ed will be coming in. That was tabled. We have the approval of the Gator was tabled, and then we have the reorganization of the school board was tabled, and then the 1, 2, 3, 4, 5 board policies were all tabled.
Anything else, guys?
I'm sure we will, but not off the top of my head right now.
Okay. Then I will entertain a motion.
I move to adjourn.
Second.
Been properly moved and seconded twice that we adjourn. All in favor signify by saying aye.
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 All opposed? Motion passes. We are adjourned.